Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
If it is not treated at the apt moment, not diagnosed at the apt moment, it can lead to death. It can radiate to your left arm, to your left shoulder, or to your lower jaw. You just walk around 100 meters or 200 meters or a small elevation and you become breathless. You have to stop for breath. That means you have to be careful and visit your doctor and get your cardiological status evaluated. You might have seen that there are some people who have suddenly collapsed and died. And even sometimes it can even present just as a heartburn.
Okay.
You may have just a heartburn.
Hello dear friends, good evening. Welcome to today's episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. In each episode of this talk show, we try to bring before you an expert doctor from Al Hilal Hospital to discuss your various health issues. Today we will be discussing about myocardial infarction, commonly known as heart attack. A heart attack can strike suddenly, but warning signs are often there. And to discuss about this topic, we have with us Dr. Ben Matthew from Al Hilal Hospital, Moharek branch. He is a specialist in internal medicine and he has an experience of more than 20 years. So doctor, welcome to the show.
Thank you very much and good evening. Yeah.
So doctor, this is a very relevant topic now. We hear a lot of deaths due to heart attack recently. So what is myocardial infarction and how do you describe it?
Okay, I'll try to keep it smooth and so everyone will get a take-home message. Actually, myocardial infarction, like you told, is heart attack. Okay, in the word myocardial infarction itself, it's there. Like myocardium, that means the heart muscle, and infarction, that is the death of the tissues. That is the death of the heart muscle. So in myocardial infarction, basically what is heart attack is the part of the myocardium or the heart muscle dies because of lack of blood supply, because one of the coronary arteries is blocked. It's blocked and then the blood supply to that region is cut off and the patient suffers a myocardial infarction. And if not treated properly, because it is very time critical, if it is not treated at the apt moment, not diagnosed at the apt moment, it can lead to death.
Doctor, how does this condition differ from the other heart-related conditions like angina and cardiac arrest?
Yeah, see, myocardial infarction is an entity. Myocardial infarction is an entity. It's a what do you say? It's a event that has occurred. At the same time, angina just means chest pain. Chest pain due to decreased blood supply. In myocardial infarction, the whole blood supply is cut off. But angina, there is two types, stable angina and unstable angina. Stable angina occurs when a person exerts himself. Maybe he goes a bit of running or does some extra work than normal. And then because of that atherosclerotic plaque there, the blood supply to that region is compromised. So he develops chest pain. But when he rests, it comes back. And then, the pain decreases because the blood supply to that region has returned. Unstable angina is even more serious. It can be a forerunner of a myocardial infarction. So unstable angina patients should be treated as soon as possible, but the treatment changes for unstable angina and myocardial infarction. Unstable angina can be a forerunner of myocardial infarction, so we have to treat it and diagnose it at the right moment and do angiogram as soon as possible to see if any blocks can be treated by stenting. And then, like you said, the cardiac arrest. Cardiac arrest is like the stoppage of the heart. Cardiac arrest can occur due to many causes. It can occur due to electrolyte imbalances. It can occur due to septicemia. It can occur due to electrocution. Get electrocuted, the heart stops. These are all cardiac arrests. So the final mode of death is cardiac arrest. And myocardial infarction also can cause cardiac arrest if not treated at the right time.
Now, doctor, can you explain about the common causes of heart attack?
Yeah, the common causes of heart attack is, first thing is coronary artery disease. For that, you should know the mechanism of how myocardial infarction occurs. In myocardial infarction, there is an atherosclerotic plaque. Atherosclerotic plaque which gets thinned out, gets ulcerated, and then it ruptures. Once the atherosclerotic plaque ruptures, then a catastrophic thrombus forms there, and the whole blood supply to the heart muscle is cut off, and the patient develops myocardial infarction. So the causes, first thing is coronary artery disease. That is this atherosclerotic plaque rupturing and then causing heart attack. Then there are other causes like coronary vasospasm. That is, the coronary vessel undergoes constriction. This normally seen in cocaine addicts. Cocaine users can develop this type of myocardial infarction. Then there is even emotional stress, significant emotional stress. It's actually a syndrome, Takotsubo syndrome. Okay, it's also known as the broken heart syndrome. So severe emotional stress also can cause coronary vasospasm, and if prolonged, can cause a severe MI. So basically, the commonest cause is rupture of the atherosclerotic plaque.
Now you mentioned about the stress causing heart attack. So how do lifestyle choices like diet, exercise, stress, etc. cause heart attack?
Yeah, for that first we have to understand the risk factors for a myocardial infarction. So these risk factors, if taken care of, your chances of developing myocardial infarction comes down significantly. Now, talking about risk factors, you have modifiable and not modifiable risk factors. Which are the non-modifiable risk factors? Age, family history, and the sex. If you are a male, you are almost 2 times more prone to develop myocardial infarction, because in females it is less comparatively. Then second, family history. Family history of myocardial infarction. For example, if you have a first-degree male relative, that is your father or your brother, who has developed myocardial infarction before the age of 55, they are more prone to develop myocardial infarction. If you have a female first-degree relative, mother or sister, who developed MI less than the age of 65, then again you are at high risk of developing this thing. And then age, elderly age is more prone for developing myocardial infarction. But these are non-modifiable risk factors. But then you have modifiable risk factors. For example, smoking, you have to quit smoking. And then blood pressure, you have to keep blood pressure under control. Diabetes has to be kept well under control. Then cholesterol levels, your cholesterol levels, especially LDL cholesterol levels, should be well under control. And then obesity. If you are obese, obesity is determined based on your body mass index. Any body mass index above 25, that's overweight, and above 30, you are obese. So you have to bring down your body mass index to the appropriate levels, less than 25, reducing weight and exercise. So lack of physical inactivity also, there is chances for forming atherosclerotic plaques. So all these things, high blood pressure, sugar, smoking, excessive alcohol consumption, and lack of physical activity, all these things promote atherosclerotic plaque formation. And once the atherosclerotic plaque formation is too much, then there is high chance of it rupturing and developing a myocardial infarction. So risk factors have to be taken care of.
Okay. Yeah. Now, what are the early warning signs that one should look forward to in the case of heart attack?
Yeah, it's early warning signs means basically what we ask is whether the patient develops any dyspnea and shortness of breath, even on exertion of for normal exertion. For example, you climb up one flight of stairs, or you just walk around 100 meters or 200 meters or a small elevation and you become breathless. You have to stop for breath. That means you have to be careful and visit your doctor and get your cardiological status evaluated. Myocardial infarction, there is no warning signs, only maybe you develop a dyspnea, shortness of breath on normal exertion. That can be the only symptom sometimes. Other things that once you develop MI, you will be getting severe retrosternal chest pain. That is, in the central part of your chest, you will be having a squeezing, compressing type of pain. And it can radiate to your left arm, to your left shoulder, or to your lower jaw. So once that occurs, then you should be very careful and you should know that most probably it's an MI and seek for help.
Can a person have heart attack without chest pain?
Yes, that's called silent MI, silent myocardial infarction. Because you might have seen that there are some people who have suddenly collapsed and died. And so maybe only on autopsy you will come to know that it was a myocardial infarction. Or sometimes like the patient suddenly becomes dizzy, falls down, develops a syncopal attack. You take him to the hospital. When they take a ECG, you see that the patient has developed a myocardial infarction. This normally occurs in people in diabetics. Diabetics because their autonomic nervous system. Autonomic nervous system is the one that takes care of all the nervous innervation to all your organs inside. So autonomic neuropathy, uncontrolled diabetes, their autonomic nervous system, they have dysfunction. So they will not perceive the pain. So it can develop a silent MI. Then elderly age people also above the age of 75, 80, they can have the same nervous dysfunction. They will also not perceive pain. Then one very uncommon thing, but heart transplant patient, the recipient patient doesn't have nervous innervation to the heart, to the donated heart. So those people also can develop silent MI. Mainly in diabetics. Diabetics, they are very prone to develop silent MI.
Doctor, how important is time in treating heart attack?
I told you before also,
yes.
Myocardial infarction is very, very time critical. You have to make an early diagnosis. You have any suspicion of a patient who develops sudden chest pain, retrosternal chest pain radiating to the jaw or radiating to the left shoulder, should be immediately rushed to the hospital. Sometimes this central chest pain, especially in females, the pain frequency is less. They can have nausea, they can have vomiting, they can have sweating. All these things are also signs of MI. Normally when you develop central chest pain, you will develop sweating, nausea, vomiting, tiredness, dizziness, all these things. So all these are symptoms that you are having an MI. Yeah. And even sometimes it can even present just as a heartburn.
Okay.
You may have just a heartburn. So you cannot neglect that. Heartburn that lasts more than 20 minutes and everything, immediately you have to go to hospital.
So when a patient comes to you with the symptoms, how do you diagnose it's a heart attack? What are the tests to be done at hospital?
Yeah, all these patients who come to the hospital, immediately the first thing who present with this typical angina complaints, first thing we do is a ECG. ECG will show ST segment elevation. So if the ST segment elevation is there, that means it is an ongoing myocardial infarction. And we'll be doing other blood tests like troponin I. Troponin I, it's a cardiac marker, CPK, CPK-MB, but troponin I is a very good test. Troponin I, but the problem is that troponin I will be positive only after 6 hours. Okay. The initial ECG may or may not show any changes. So if the ECG doesn't show any changes and the patient has the typical symptoms, maybe we can repeat the ECG after 10-15 minutes more. And then if the patient presents too early and if you are still in doubt, an echocardiography can be done to look for any regional wall motion abnormality of the heart, and we can diagnose the myocardial infarction.
So when a patient comes to you, what are the immediate treatment options you go for?
If we diagnose MI, all patients should be immediately given aspirin, clopidogrel. Okay. This is the antiplatelet agents. They will be given a dose of heparin, a shot of heparin, and statin, which is a medicine used for hypercholesterolemia. So we'll be giving high dose statin, aspirin, clopidogrel and heparin. This is the basic treatment which should be given. And in case of ongoing chest pain and blood pressure is stable, we'll be even starting him on injection nitroglycerin or sublingual nitroglycerin. And if the patient pain is too much, even opioids will be given.
Immediate treatment.
Yeah, these are all the basic treatment. It's easy to remember, MONA, MONA. So morphine, supplemental oxygen, nitrates, and aspirin.
So, doctor, what is the role of angioplasty and bypass surgery in heart attack?
Yes. Now coming to this, this is a treatment actually. See, I told you myocardial infarction is very time critical. So if you are in a center, the patient presents to you, and this angioplasty, that is PCI, percutaneous coronary intervention, should be done within 90 to 120 minutes. What they say is door to balloon time. The patient arrives at the emergency department, door to balloon time should be ideally 90 minutes. If you do the angioplasty within this period, the results are very good. And suppose you are in a facility where you don't have this angioplasty, or the patient is, it's going to take more than 2-3 hours for the patient to reach the next center. So you can't keep the patient there in that condition. So then you have to immediately start on the next option, which is thrombolysis, thrombolytic therapy. Here we use injections like streptokinase or urokinase to dissolve the clot. Yeah. So again for that, it is a door to needle time should be 30 minutes ideally. It should be started within 30 minutes of the patient arriving to the emergency.
Can you explain about the recovery after heart attack? What are the things to be taken into account?
Recovery after heart attack is that once a patient, maybe a stenting is done and the patient has returned home, and then after that for around 1 to 2 weeks he should take proper rest, and then he should do all the lifestyle modification which I told before. He should quit smoking, he should take his medicines, strict adherence to the medicines. That's very important. Keep his blood pressure under control, keep his sugar under control. And then there is another question which everyone asks, whether I can do exercise after MI.
Yes.
Yeah. So after MI also, whether you developed heart failure, whether you have heart failure or whether you are post MI also, you should do exercise. You should do exercise. Physical activity is very important.
Doctor, now coming to complications. What are the complications of having a heart attack?
Yeah. Post MI, there can be complications. All cases are not straightforward. If it is a large MI, patients can develop heart failure.
Okay.
And then sometimes you can develop irregular heart rhythms. It's called arrhythmia. It can be, you can develop heart blocks, or you can develop very fast rhythms like ventricular tachycardia or atrial fibrillation. And then the patient can develop cardiogenic shock and even sometimes into cardiac arrest. It depends. So basically it's heart failure, abnormal rhythms, cardiogenic shock and cardiac arrest. These are the complications normally.
Now coming to the most important part of our discussion. Can we prevent heart attack?
Yes, we can surely prevent heart attack. I told you there are some things which are not modifiable. For example, your age, your sex and your family history. But there are things which you can prevent your heart attack. For example, if you are obese, you can reduce weight, bring your body weight to the ideal weight, quit smoking, avoid alcohol, and strict control of blood pressure, diabetes and your lipid levels. All these things you can, and adequate exercise.
Okay.
These will all help in preventing MI.
So doctor, what message you have to give to our viewers who are worried about having early warning signs?
Yeah, those who are in early warning signs, they surely have to go to the doctor. They have to go to the physician or the cardiologist and get themselves thoroughly evaluated. They have shortness of breath, like I told you, on climbing a short flight of stairs or just walking 50 meters, 100 meters. They have to surely get evaluated. Then basically all the things like I told you, the lifestyle modification is very important. Quit smoking, reduce alcohol, adequate control of blood pressure, diabetes, lipid levels, and physical activity is very important. Exercise. Yeah.
So doctor, can you suggest a healthy diet for our viewers?
Basically, we should avoid all processed and refined foods and try to consume more of whole foods. And a study was made and they found out that the diet that was the best diet throughout the world was the Mediterranean diet. The Mediterranean diet, they include they use olive oil and they used more of vegetables, whole foods, lean meat, fish. So basically their diet was found out to be good. And we should avoid saturated oils, saturated fats. use more of use unsaturated fats as much as possible. Avoid all these dalda, vanaspati, those things. But I think nowadays people are health conscious, they know about that. Yeah.
And finally, doctor, what do you have to say about Al Hilal Healthcare Service?
Yeah, Al Hilal Healthcare Service, basically our mission is to deliver quality healthcare and compassionate healthcare for the people of Bahrain. And our main mission is to deliver quality healthcare and exemplary healthcare at an affordable cost. Yeah.
Thank you, doctor. Thank you very much.
Thank you. Thank you. Yeah.
So viewers, as we wrap up today's talk show on heart attack, let's remember, proper awareness, timely action and healthy lifestyle changes can make a huge difference. Take care of your heart because it takes care of you. Till we meet again in next week with a new doctor and a new topic, this is Jessila Mujib signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.